I'm Paul Kiritsis. I'm a board-certified orthopedic surgeon, and I work for Ortho Virginia here in Richmond, Virginia. And I'd like to discuss with you today the precision shoulder. Precision shoulder is a multi-layered approach to shoulder replacement surgery. So let's first talk about shoulder replacement surgery, and then we'll get into the precision shoulder more specifically. The surgical procedure for a shoulder replacement involves an approach, and so what we do is we go in first and we make an incision here, and we go in between the deltoid and the pectoralis in the front of your shoulder, and then we get down to the rotator cuff, and this rotator cuff muscle is called the subscapularis. And what we do is we have to peel that subscapularis back and repair it later. How I do that is the hallmark and the first component of the precision shoulder, and we'll get more into that in a moment. But once you get that subscapularis out of the way, it exposes your normal ball. And then what we do is we trim that ball, we place a metal ball in there just like you see here. And this is part of your replacement, and you have a new metal ball. And then on the socket side, which is here, this is your scapula and this is your glenoid, the socket. And what we do is we shave that back to the normal position and we place a socket there. And this is a plastic socket. And so the new metal ball and your plastic socket make up your shoulder replacement. And this is an anatomic shoulder because it reproduces the normal anatomy. First component of the precision shoulder is my patent pending technique for repairing this subscapularis. What I have designed is a technique that encompasses these self-tensioning devices. And these are devices that are available on the market but have never been used in the repair of the subscapularis. And what I can do is I can repair this tendon back down and I can tension it exactly how I want it. And then I can take the shoulder and I can range it and I can move it all around, and then I can retension it. That's important because every repair we do in orthopedics has some micromotion, some amount of creep to it. And by bringing that creep out, by making it come forward, I can then retension it and then take that creep out of the system. And that enables me to establish an incredibly strong and tight repair with no micromotion. And it will significantly reduce the risk of that repair failing. So that's incredibly important, and the first component to this precision shoulder technique and the hallmark of the precision shoulder. The second component is a personalized treatment plan. Now this includes 3D surgical planning software, and we use this software to determine the exact size and the exact position of the implants for each patient. Now this patient-specific size matching enables me to best reproduce your normal anatomy, and I think this is incredibly important. The third component to this are the surgeon's attributes. Now, I'm a high volume surgeon. I do well over 100 shoulder replacements a year and very close to 200 this past year. Now, it has been shown in the literature that high volume surgeons have better outcomes and less complications. In addition, I've been designated by insurance carriers as a preferred shoulder surgeon. This shows a long history of excellent outcomes and reduced complications from total shoulder replacement surgery, sorry. Now, I also have a sports medicine background and I am board certified in sports medicine. This gives me a unique perspective. I know the therapy protocols very well, and I'm able to use my sports medicine background to get my patients back to their pre-surgical level of activities and back to the activities that they want to perform. And I think this is critical. In addition, I have a long history of product development. I have multiple patents. And this product development, the design of these implants, I'm involved in designing these implants. This gives me a unique perspective. I understand how the implants are supposed to be positioned, how they're supposed to be sized, and it gives me the ability to appropriately match your anatomy to the implants that are available. The final component is the state-of-the-art anesthesia techniques that I employ our anesthesiologists to perform. And what this does is this gives you less pain and better long-term outcomes during the post-operative period. I look forward to discussing the precision shoulder with you and how we can reduce your pain and get you back to the activities that are so important to your quality of life.